The Kahnawake COVID-19 Task Force Update. I'm in for Joe Daryl. We have three guests today. Lloyd Phillips. In from Tewatohnhi'saktha Business Services is Daryl Leclaire, so businesses are going to want to stay tuned to this one. And we also have a special guest who has decided to come back to the set now that Trump's out of office. But you'll have to stay tuned to see who that guest is. But they have very important information. Before we get to that though, ever since this pandemic started, the task force has been in the difficult situation where they have to decide on whether or not to keep businesses open or close them. Luckily, they've been staying open. That's been the plan. It's the plan going forward. And here to explain what goes into those decisions is Commissioner of Public Safety, Lloyd Phillips.
Thank you, Neil. Good afternoon, everybody. Yeah, we're here just to talk a little bit about the, updated relationship between the task force and Tewatohnhi'saktha, and certainly Daryl will have some information to add to this once I'm finished. But yeah, since the beginning of the pandemic, it's certainly been one of the biggest issues that the task force has dealt with is whether or not to keep businesses open, whether or not to modify their operations, and when to open and when to close. So it's always a struggle. It's always causes a lot of stress and anxiety, not only on the task force, but on the community, and certainly the business owners themselves. These decisions certainly don't come easy. There are several factors that play into them. And let me just restate, as we speak today, there is no intention, as we speak today, to have additional measures or further business closures. That's not part of the existing plan. But as we said many times, and on the radio and other places, we always got to plan ahead, just in case things go down paths that we don't like or that causes a lot of concern to the community. We have to be prepared to act. So we have to, and that's basically what we've been doing for the past little while, working more closely with Tewatohnhi'saktha. These are certainly very difficult decisions, if and when they do come about. We had witnessed that in March. As difficult as it was to make the determination to close businesses back in March, opening them was just as difficult, if not more difficult, because not all businesses were opening. And now, fast forward several months, it still is a very difficult decision because there are businesses such as the gaming, there are bars, restaurants are only takeout only, so there are still some businesses that are impacted. And we understand the stressors that are involved on there. So our goal is to reverse or relax measures as soon as all the right indicators are in place to do so, and minimize the impacts on business as much as we possibly can. And we're asked many times, like, what is your determining factor to whether or not a business stays open or closed? And there's no simple answer to say, it's not black and white, it's not on and off. There's many factors, and we talked about a lot of them in the past. Obviously, we have to see what's happening in the community. What is the positivity rate, or is there any active cases within the community? If so, how much? What is the number of cases in Quebec, and more specifically, what's happening in the greater Montreal area, surrounding Kahnawake? We have to be aware of what's happening there. Assess what Quebec is doing in terms of their businesses. Also plays in another factor. The infection, the R factor, as we talk about several times, or the rate of spread of the virus is another key component that we have to look at. The number of percentage positives, so how many positive tests come back per the number of tests that were actually given is another indicator. But also identifying the businesses as a whole, identifying the areas that of highest risk. A lot to do with what businesses have the highest risk of having a contact, within the 6 feet, longer than 10 minutes. Looking at that type of assessment, which businesses pose that risk. assess what mitigation measures are currently in place, and again, reducing the risk of potential spread of the virus. So it's no simple answer, and there's a multitude of factors that go into it. And obviously, along those lines is also the continuing and ongoing input and guidance from our medical advisors that help us, maybe clarify or help guide us in certain directions, again, based on all the science that I'm sure like somebody like Dr. Gauthier knows a heck of a lot more than I do regarding those specifics. So we pull all this information together. So what I want to maybe introduce here now is or end on is this saying that this is basically a constant moving target. We are not at the point where we're ready to make any decisions on closures, but we are certainly looking forward into the future and planning again on the just-in-case scenarios or the what-if scenarios, and be prepared. Making plans, to be honest with you, that I hope we never have to use, but we'll have them in place if we do. Now we'll go up.
Now, Lloyd, so difficult place to be in. As Lloyd stated, Tewatohnhi'saktha doesn't have anything to do with the task force decisions on business closures or even if they increase measures, etc. Their job is to prepare businesses if that happens. So it's just to plan ahead, like Lloyd was saying. There was a press release earlier today on this note, so you might want to check that out on the Tewatohnhi'saktha Facebook page and website. Also, Tewatohnhi'saktha has taken more of a proactive approach here during the pandemic with the business community. And one of those is to sit in on task force meetings. So we're just sitting in, but the person who's going to be sitting in on the first task force meeting this week is here to join us now to talk about how you can plan ahead and some of the different things that are available to you. And that's Business Services Officer Daryl Leclaire.
Thank you, Lloyd. Thank you, Neil. As mentioned, my role here today, I guess, is to talk more about how Tewatohnhi'saktha is here to assist you to prepare for the eventuality, as Lloyd mentioned. There are no plans currently to do so, but in the eventuality that happens, some of the steps that you can take as a business owner to assist yourself. Right now, some of our businesses have already doing certain things like delivery, curbside pickup, online sales. We encourage that to continue doing that. If you're not doing that already, to speak with your business services representative. Besides myself and Tammy Delarond, there's also Corinne Delormier and Christy Kennedy who are doing that. If you've spoken with one of us since March to access financing or assistance because of COVID, you would speak with the same person. If you haven't spoken with anybody, call the main office, which is 450-638-4280, and we'll put you in touch with somebody to assist you with that. In the eventuality that stricter measures are, I guess, selected by the task force, some of the things that we're encouraging, I guess, is to look at your options now to say, well, this is something that I'd be looking at. Again, some of the options I mentioned already, curbside pickup, online sales, and a drive-through window is, I guess, start putting some of the, the steps in motion as much as you can to work towards that. So if there are closures, some of the ideas as well that could be looked at as possible options, reduce the numbers of clients that are currently within your business. I know all of you put together a plan with the task force and the inspectors to say these are the parameters for my business, these many people are allowed in at this much time. That could be one of your options, is to reduce that number even further, as well as increase the distance inside your business between you and your customers, or even between the customers themselves. That does tie hand in hand with saying less customers in the store, but it could also just be dividing zones or something like that. As well, additional plexiglass, dividers, those kinds of things could be used as well to create a safer zone for you and your customers. The question always comes up, is there money to assist with this? If the task force mandates there are business closures, in that set of circumstances, yes, there is funds available. Specifically, if you were, the example I can give is as I believe it was October 1st, restaurants had their dining rooms closed. They're still allowed to offer takeout and delivery, but the dining rooms themselves are closed. They can apply for what is known as the Business Interruption Fund, known to us as BIF. And the amounts that they can access is up to $8,500. The same bills that were eligible previously remain eligible, would become eligible again if there was closures by the task force. That becomes bills like your hydro, your insurance, your telephone, internet, basically your operational costs are what would be eligible. The upper limit on that is $8,500 per month. And as long as you are closed by the task force, you are eligible to apply for that again. Again, right now, the only ones that have been reclosed have been as Lloyd mentioned, the dining rooms for the restaurants, as well as the gaming facilities. And there are a handful of industries as well that never were able to open, such as the bars or the kids' play zones, those kinds of things. And then the final one is if there are closures, and we've mentioned certain things like plexiglass, additional plexiglass, some of you have already accessed it, but if the inspectors indicated that you required additional plexiglass, or if you were able to do a drive-through at the time you were closed by the task force, you could apply for the Business Interruption Fund, not the Business Interruption Fund, the Fit-Up Fund, which allows you to access funding for those things, and that's at a maximum of $3,000. Just to reiterate, we are being proactive at this time. It is not to say that these funds are available to you now, but it is in the eventuality that should you be closed by the task force. Thank you.
Now, Daryl, great job. I think he covered just about everything there for the business community. Certainly appreciate having business service officers like Daryl to look out for your needs. Again, it's only in the event that the task force changes course, which they haven't, so it's just to plan ahead in case that happens. Just in case, so recently we had an election in the States, and Donald Trump was ousted, and I don't think he's been very good in COVID. One person who's very happy about that, so happy she decided to return here to Kahnawake 911, talk about vaccines and other things, but I'll leave that to her. Our next guest, please welcome Dr. Gauthier.
Kahnawà, Segu, Kahnawake. So I am happy that Donald Trump hasn't been elected, and our neighbors to the south have picked some very interesting people who, one of the things in my point of view is their belief in science and their belief in medicine. So I'm here today to talk a little bit about some different things that have come across the media, some new advances, and then some old things that have been sort of making the rounds lately. So I wanted to sort of dispel some rumors. So the whole question of is COVID or SARS-CoV-2 aerosol or a contact? Is it from droplets or is it from aerosol? And it's been back and forth through the whole pandemic. And I think with good intentions, the Public Health Agency of Canada changed their website to indicate that it's a continuum. And this has actually been what we've been saying since well back, and now it seems like another lifetime ago, but I believe it was May. And basically, most SARS-CoV-2 is spread through droplets. However, there are aerosols that come out, and there's no such thing as a perfectly droplet virus and a perfectly aerosolized virus. It's always a continuum. So that's why we need to look at the continuum, and on that continuum, SARS-CoV-2, COVID, lies more closer to droplets than to aerosols. So I think that's one point. The second thing that Dr. Tam and Public Health Agency of Canada have talked about is having a 3-layer masks. And specifically, it's actually having the regular masks that we talk about of cotton or polypropylene or whatever on the inside and outside, but then having a middle layer that's a filter. So while this is interesting and potentially could add to safety, the actual evidence does not say that you should throw out all your masks, all your 2-layer masks. Keep them. okay? A mask is better than no mask. And the actual data that has been collected over this pandemic on SARS-CoV-2 and general respiratory droplets leaving your mouth is that 2-ply masks are about as equivalent as a medical procedure mask, okay? So it's almost as good. N95 is a tiny bit better than that, but that's it. That's what we're looking at. So I haven't been able to find any evidence, and I've checked with a lot of my medical colleagues, and there's a 22,000 strong physicians Facebook group that's secret that we talk about these things, and no one was able to find this evidence for 3-ply being better than 2. So I think it's just making sure that we're doing as safe as we can. What is known is if you use reusable masks, you have to wash them. So I hope that you're all like me, and to be honest, how much I work, it's really more my husband who does the laundry. But so like pretend, this weekend it was me actually, but usually it's him. So you wash the masks, you hang them up to dry, you put them in their little bags so that they're ready to go, because I have, probably like you, have multiple size faces, and one thing that we know is you have the mask, but it has to fit your face correctly. So if it's hanging off the edge, if it's too big, that's where air can escape and droplets and potentially little aerosols can escape. So that's what we're looking at. The third thing I want to talk about was vaccines. So it's made the news. Everyone calls it the Pfizer vaccine. I just want to let you know Pfizer in-licensed it from BioNTech. So it's actually a small biotech company with Pfizer got together, and they made a vaccine that looks quite interesting. So is it something to celebrate? Absolutely. Is it something to hang our hat on? No. And the reason for that is we have to do all of the safety steps. We're not going to license a vaccine and have it available on the market for everyone to take if we haven't done all of the precautions that we need to do. So what is this vaccine? So SARS-CoV-2 has a protein called spike protein. They've taken RNA, so that's the molecular, we're DNA in our cells, or DNA. SARS-CoV-2 is an RNA virus. So you've taken SARS-CoV-2 spike RNA, and then they've surrounded it by a little lipid or fat nanoparticle being really, really tiny. And then they've used that as an injection, and they inject at week 0, and then 3 weeks later, they'll inject it into the patient. And they've done this on a little but small trials initially, early on this year into June, and they found that there actually is very good both B cell and T cell immunity. So go back, I guess my talk in probably June, I talked about how and that's why you shouldn't pay the money to get an antibody test, is because for SARS-CoV-2 immunity or COVID immunity, you need likely a B cell, so antibody response, and a T cell, so cell-mediated response. Well, this vaccine, this Pfizer BioNTech vaccine, raises both those immune responses, so that's why it's excellent. And then even more so, and this is not published data, this is just on a press release from the company, and then me trying to get as much information as I can on it. It was showing that they vaccinated 22,000 people starting in July 27th with this vaccine. 22,000 people got a sham vaccine, so just the lipid nanoparticle with no SARS-CoV-2 RNA. And they vaccinated those people, and it was blinded. So double blind means the person getting the vaccine didn't know what they were getting, and the person that was analyzing the results didn't know what they were getting. They had made a decision ahead of time with their ethics board and their safety board that after they had 62 COVID positive cases, they would unblind, so that means look at the data. And actually, within a week of having the second vaccine given to the patients, unfortunately a lot of these were done in the US, and we all saw that there was lots of spikes in the US of COVID cases. There was actually 94 positive cases within this clinical trial. So that's both arms, both the vaccine arm and the sham or the mock vaccinated arm. And so what they did was they looked at the data, and it's 90% of those 94 cases were in the sham vaccinated, so the no RNA, the no SARS-CoV-2 vaccine. So that means when you do the math, it ends up being 90% effective, this vaccine, at preventing a real-life SARS-CoV-2 infection. So let's just make it clear to everyone. They didn't go around infecting people with SARS-CoV-2. They just let them go about their life, follow, of course, distance, hygiene, masking measures, and of those 44,000 people, 94 people got sick, and of that 90% were in the sham vaccinated. So it's really quite interesting. What's also super interesting is that the clinical trials and the safety trials are ongoing, and the government of Canada has already invested money into this, so we will definitely be receiving some vaccines. Who will get the vaccine? Will we go for the super spreaders? Will we go for the most vulnerable? That is to be decided yet, and we still have considerable amounts of time before this happens. On the clinicaltrials.gov, which shows all clinical trials that are licensed to happen in the US, the end date for this trial is set for 2022. Okay, so this is not we're going to have a vaccine ready in January. This is a longer term thing. So that brings back to it. What's the important things? It is distance of 2 meters. It's hygiene, washing your hands at every instance, and it's masking. Now, going off from the SARS-CoV-2 vaccine, I'm going to talk about another vaccine. And the other vaccine I want to talk about is the flu vaccine. So I am so proud of you, Kahnawake, for reaching out and everyone wanting to get vaccinated, having the elders vaccinated, having people coming in and going to the vaccine clinics. You've been so successful in this that we actually are running out of stock. So as of November 14th, all the future appointments will be postponed while we get more stock coming in. And then we are really going to prioritize our most vulnerable, our elders, and then there will be a new schedule set up. So apologies to those that have a vaccine scheduled for November 14th or afterwards. We're going to be on hold for a second and stay tuned for more information. The last thing I wanted to tell you was that KMHC is having a drop-off for inpatient on Sunday from 10 to 1 p.m. Remember, it's all packaged things that are easily to be washed. I don't want you to bring things that are not easily to be washed, because then my colleagues are going to be like, hey, Dr. Gauthier, you didn't tell the people the right information. With that, I want to say thank you, stay safe, have a lovely day.
Now, Dr. Gauthier, I wonder what would happen if Trump got in. We wouldn't have had all that valuable information to share here today. We still would have got it, though. Just I don't know if she would have made an appearance. So thankfully that happened down south. And they always say it never affects us, the election results. So there you go. Want to remind everybody, tomorrow there's many closures, many organizations. It's Remembrance Day, Wednesday, November 11th. That means there will be no task force meeting as well. That's been moved to Thursday. So with that, stay safe, stay home, and we'll see you next time.